Now, doctors' surgeries in some parts of England are closing the door on new patients because they're struggling to cope with their existing caseload. A BBC investigation has found that at least 100 GP surgeries applied to NHS England to stop accepting new people because they're full. In Clacton in Essex, it is a particular problem. 3 out of 4 of the practices in the town are not taking on any new patients. Well, we can talk now to Andrew Sarek, who's business manager at Ranworth Surgery in Clacton. His surgery has been struggling to recruit new doctors. We're also joined by Kevin Symes, a patient at Ranworth and chairman of the local patient participation group. Thank you both for joining us. To you, first of all, Andrew, just tell us why you stopped taking on patients.
Good morning. We took the difficult decision about 6 months ago. One of the other practices had to close their list, so more and more patients were joining us at a rate of around 120 new patients every month. We spent so much time on the admin and other clinical needs of those new patients, we were finding we weren't able to adequately deal with our current patients. So we took that difficult decision and said we can't accept any more, because we're up to 8,000 patients with just 3 doctors to look after them.
So the domino effect, obviously, but what was the initial cause of it? Is there difficulty recruiting GPs, or has there been a sudden influx of people wanting to sign on for GPs?
I think it's a bit of both. Certainly the demand from patients is much, much higher in the last 2 or 3 years. They're coming in for all sorts of things and far more than before. Also, a couple of doctors retired from the area and recruiting was very difficult. So it's a combination of things, really.
And where are these new patients coming from?
Well, there's a lot of building going on in Clacton. I think 12,000 new homes eventually will be built here. They need doctors, they need schooling, they need all the normal facilities that any town needs. But I'm afraid we haven't got the number of doctors isn't increasing along with the patients.
Why not? Why is it so difficult to get new doctors?
I think there's a national shortage, as you've already highlighted. Clacton is a difficult area to be a doctor. It's difficult everywhere. Clacton has particular problems, high deprivation. In fact, the highest, most deprived ward in the country is just a couple of miles away from here. As an example, in the centre of Clacton, life expectancy, male life expectancy, that is 72 compared to 84 just 10 miles away. So there's a lot of pathology, a lot of asthmatics, diabetics, other respiratory problems, people with heart disease. So it's tough being a doctor here. You've got a lot of people to look after and people with complex needs.
Kevin, you're a patient at Ranworth Surgery and you're also the chairman of the patient participation group. What have your experiences been?
I think the difficulty has been for patients actually to see that.
Oh, we've got a bit of a problem with our line to Kevin. We'll try to fix that and just go back to Andrew. Just maybe you could answer I think what he was about to say, which is how long it takes patients to actually get to see their GP. What sort of wait are patients facing when you're so oversubscribed?
Well, typically, if you want a routine appointment with your own doctor, 2 to 3 weeks it's going to take. We recognise that's not really acceptable. So what we run now is an open surgery every day. You turn up any time between 9 and 11:30, you will be seen. Maybe not by your own doctor, but by a doctor. It's really going back to the old days when I was a boy. You used to just turn up at a doctor's waiting room and you'd be seen next. That's what we're doing now. So it's not ideal, but a patient then at least knows they will be seen that day by a clinician.
What's the answer to this? Because obviously you need to try to recruit more GPs, but you were outlining before the difficulties of doing that.
Things need to change. I think the model of general practice isn't sustainable as it is. We've met with the other central Clacton practices to start talking about what can we do differently. The local clinical commissioning group, the CCG, they've arranged a meeting of all 42 practices in North East Essex to discuss different ways of working because they recognise this isn't going to be sustainable. We need to look at different ways of working, sharing resources, maybe using more nurse practitioners, having doctors in a supervisory role, looking at more of the chronic diseases, etc., while the minor illnesses are dealt with by nurse practitioners, something like that. But we're having talks. Things have to change, otherwise it will just all disappear.
I think we can bring Kevin back in. Kevin, we can see you again. So, do you have any answers here?
I think the problem is that we have 3 GPs in our practice, and each one patient is assigned a named practitioner doctor. The difficulty is trying to get in to see your actual doctor for a consultation. Minor ailments are dealt with, as Andrew just alluded to. What the problem is, if I wanted to see my own doctor, named doctor, now, I wouldn't see him till the 3rd of February. Now, that I consider to be too long, but I don't really see the way out of it. The only way out of it is if the local clinical commissioning group got the finger out and we had a super hub of doctors' surgeries where we could resource all our resources and come together as one. And that was alluded to in a document called Care Closer to Home, which was published by North East Essex Clinical Commissioning Group. It's out for consultation. I think the way forward is that they've got to get bigger to be able to cope with the demands that are actually being met. But it's very difficult, as Andrew has already alluded to recruit doctors at one of the local clinics out in the area of Frinton. They never had a doctor at the end of last year, and the whole surgery had to be taken on by ACE, which is the Anglian Communication Enterprise, Community Enterprise, and they've had to take it over, a bit like a school being taken over in special measures.
Let's just bring in the thoughts of a couple of viewers. Alan has emailed to say, I live in North Wales. My local surgery is closing in a few months, along with another doctor's surgery in the area, meaning more than 20,000 people are without access to a doctor, and the Health Board is planning an alternative, but information is limited as to what they're planning. Derek has emailed to say there are plenty of doctors, just too many people. Health service, too many people. Schools, too many people. Jobs, too many people. Housing, too many people. And it is getting worse. You were saying, Andrew, that the old model of GPs' practices just isn't working. And you were sort of talking about preliminary discussions in terms of how to change things. Do you think it is going to be a model that just will, as we know it now, will just have to change over in coming years?
Certainly in this area, things will need to change. In other areas, it can continue, I'm sure, for a while yet. But we're under pressure now. If 1, 2, or maybe 3 doctors were to leave or retire, it would be chaos, because there just wouldn't be people coming in. So we must change the way we work. We have to work together far more than we have, so that we can provide the service we're providing now.
A few more texts and emails. Thank you both. Tone has tweeted to say our doctors in Basingstoke have 15,000 patients. We did have 8 doctors. 1 has retired, 2 on maternity. It takes 3 weeks to see a doctor. Lulu has emailed, I constantly have a problem getting an appointment with my doctor. Most of the time I have to wait 5 weeks because she only works a few hours a week. And an anonymous texter, if GPs' surgeries didn't block new patients from outside catchments, it would allow patients to change surgery and open up books. Thank you both. Some thoughts